Your doctor probably handed you this prescription with a smile, told you it was safe, and sent you on your way. But what if that very pill sitting on your nightstand right now is quietly stealing your memory one dose at a time? What if the medication meant to help your body is actually accelerating the breakdown of your brain? I know that sounds alarming. I know it goes against everything you've been told, but the science is real. The research is mounting, and today I'm going to give you the truth that too many physicians simply don't have time to share. I'm Dr. Alan Mandell, and in my decades of clinical practice, I have watched patients come into my office sharper than ever, only to return months later struggling to recall their grandchildren's names. And in case after case, we traced it back to a medication, not a street drug, not something exotic, a common, everyday prescription that millions of seniors take without a second thought. A landmark study published in JAMA Internal Medicine following over 3,500 adults aged 65 and older for 7 years found that people who regularly took certain classes of medications had up to a 54% higher risk of developing dementia, including Alzheimer's disease. 54%. That is not a rounding error. That is not a statistical anomaly. That is a crisis hiding inside medicine cabinets across America. And here's what I really want you to stay for, because number 2 on today's list is a medication so common, so widely trusted, that I'd estimate half the people watching this video have taken it in the last 30 days. You absolutely need to hear about that one. But before we dive in, I want to ask you something. Tell me in the comments below, how old are you? And are you currently taking any prescription medications on a regular basis? I personally read every single comment on this channel, and your answer genuinely helps me create content that serves you better. Now let's get into the 9 medications that can trigger rapid cognitive decline, going from number 9 down to the most dangerous at number 1. Coming in at number 9, and it might catch you off guard, we're talking about a class of medications called proton pump inhibitors, or PPIs. You probably know them by their brand names: Prilosec, Nexium, Prevacid. These are the little pills that millions of seniors take every single morning to manage acid reflux and heartburn. They seem completely harmless, but researchers at the German Center for Neurodegenerative Diseases analyzed data from over 73,000 patients aged 75 and older and found that regular PPI users had a 44% increased risk of developing dementia compared to those who didn't take them. Here's why this matters specifically for aging bodies. After the age of 65, your brain becomes increasingly dependent on a nutrient called vitamin B12 to maintain the myelin sheath. Think of that sheath like the plastic coating on an electrical wire. Without it, signals between brain cells misfire, slow down, and eventually stop reaching their destination. PPs dramatically reduce your stomach's ability to absorb B12 from food. And after years of use, many seniors end up severely deficient without ever knowing it. The brain, already fighting age-related inflammation, simply cannot compensate. If you are taking a PPI, talk to your doctor about whether you truly need it long-term, or whether lifestyle changes, digestive enzymes, or lower acid dietary approaches might work just as well. And if you do stay on it, ask about supplementing with methylcobalamin, the most bioavailable form of B12 taken sublingually, meaning dissolved under the tongue for maximum absorption. Pairing that B12 with folate dramatically increases its effectiveness in protecting neural tissue. Scientific references for everything I'm sharing today are linked in the description below. Number 8 is one that surprises most people, and I want you to really listen to this one. We're talking about benzodiazepines medications like Xanax, Valium, Ativan, and Klonopin. These are prescribed for anxiety, panic, sleep problems, and sometimes muscle spasms. They work by calming the brain's electrical activity, and that's exactly the problem. A major study out of the University of Bordeaux, published in the British Medical Journal, followed over 1,000 seniors over 15 years and found that those who had taken benzodiazepines had an 84% increased risk of developing Alzheimer's disease. 84%. The researchers were so startled by the findings that they replicated the study twice before publishing. Think of your brain's communication network like a busy highway. Benzodiazepines don't just slow down the cars, they shut down entire lanes. And in an aging brain that's already losing neuroplasticity at a rate of roughly 1% per year after age 60, shutting down those lanes even temporarily causes damage that accumulates invisibly over time. Margaret Chen, 74 years old from Phoenix, Arizona, came to see me after her family noticed she'd become increasingly confused and withdrawn. She'd been on a low-dose benzodiazepine for 11 years for generalized anxiety. After working with her physician to slowly taper off the medication and replacing it with magnesium glycinate, phosphatidylserine supplementation, and structured breathing exercises, her family told me 6 months later that they had their mother back. That is not unusual. That is what's possible when we address the root cause. If you're on a benzodiazepine, never stop abruptly. That can be medically dangerous. Always work with your doctor on a supervised tapering schedule, and pair that process with L-theanine supplementation, which supports calming neurotransmitter activity without the cognitive suppression. Number 7 is something almost every senior has in their bathroom: anticholinergic medications. This is a broad category, and it includes some drugs you wouldn't even suspect. Certain antihistamines like Benadryl, bladder medications like Ditropan, and some antidepressants and muscle relaxants. The University of Washington School of Pharmacy published research in JAMA Internal Medicine showing that people who took high doses of anticholinergic medications for 3 or more years had up to a 54% greater risk of dementia, and the risk remained elevated even after they stopped taking the medications. The reason this is so devastating for older adults is the acetylcholine connection. Acetylcholine is the primary memory neurotransmitter. It's the chemical messenger your brain uses to form and retrieve memories. Anticholinergic drugs, as their name literally tells you, work against acetylcholine. After age 70, your brain's ability to synthesize acetylcholine is already reduced by approximately 30 to 40% compared to your younger years. So these medications aren't just slowing down a healthy brain, they're throttling a system that's already working harder than ever just to keep pace. If any of your medications end with the phrase "helps with bladder control" or relieves allergy symptoms, bring that bottle to your next appointment and ask your doctor to check its anticholinergic burden. There are scoring systems called the Anticholinergic Cognitive Burden Scale that your physician can use to assess your total risk. Always pair cognitive support with choline-rich foods like eggs and liver, and consider alpha-GPC supplementation in consultation with your doctor. Number 6 might genuinely shock you because it's considered one of the most important medication categories in senior medicine. We're talking about statins, cholesterol-lowering medications like Lipitor, Crestor, and Zocor. Now, I want to be very careful here because statins save lives when used appropriately. But a study from the University of California, San Diego, involving over 1,000 patients, found that 75% of statin users reported cognitive side effects, including memory loss, mental confusion, and difficulty concentrating. And these effects reversed when the medication was discontinued. Here's the mechanism that really gets discussed. Your brain is 60% fat by dry weight, and cholesterol, real natural cholesterol, is essential for building synapses, which are the connection points between brain cells. Think of synapses like USB ports on a computer. Without enough cholesterol, those ports don't form properly, and information simply cannot transfer from one cell to the next. Statins reduce cholesterol everywhere in the body, including the brain, and after age 75, when neural repair mechanisms are already slowed by up to 35%, the consequences can accelerate cognitive decline significantly. If you're on a statin, this is not a reason to stop without guidance. Cardiovascular risk is real and serious, but it is a reason to ask your doctor about the lowest effective dose, to discuss CoQ10 supplementation, which statins deplete critically in aging muscle and brain tissue, and to track any cognitive changes carefully. Pairing CoQ10 with omega-3 fatty acids, specifically DHA, supports the brain's fat-based architecture in ways that can offset some of the cognitive risk. I want to pause right here, because if what you're learning today is valuable to you, I want to ask you to do two things. First, hit the like button right now. It tells YouTube that this kind of real, research-backed health information is important, and it helps us reach the seniors who need it most. And second, if you haven't subscribed to this channel yet, please do so now and hit the bell icon so you never miss a video. We upload new content every week that is specifically designed for your health and your longevity. Now, let's keep going because we're getting into the ones that matter most. Number 5 is sleeping medications, specifically a class called non-benzodiazepine hypnotics, better known as Ambien, Lunesta, and Sonata. These are among the most commonly prescribed drugs to seniors in the United States, with over 9 million Americans taking them on any given night. The National Institutes of Health published research showing that long-term Z-drug use, as these are called, was associated with a 79% increased risk of Alzheimer's disease in adults over 65. Sleep is when your brain performs what neuroscientists call glymphatic cleansing. Imagine a microscopic janitorial crew that flushes out toxic protein debris, including the beta amyloid plaques associated with Alzheimer's. These sleeping medications actually suppress the deep sleep stages, particularly slow-wave sleep and REM sleep, where this cleansing is most active. So the cruel irony is that you're taking a pill to help you sleep, but that pill is preventing your brain from doing the very repair work that sleep is meant to accomplish. After 65, natural slow-wave sleep is already reduced by up to 75% compared to young adulthood. And these medications push it even further towards zero. Harold Jenkins, 79, from Nashville, Tennessee, had been on Ambien for 6 years. His wife brought him to our clinic, convinced he had early Alzheimer's. After transitioning off the sleeping medication gradually with physician supervision and adopting a protocol of magnesium threonate at night, melatonin at low physiologic doses, and consistent sleep timing, his cognitive test scores improved by 22 points over 4 months. His wife called it a miracle. I called it biology. Number 4 brings us to a medication category with a very wholesome reputation: antacids and H2 blockers, specifically medications like Zantac before its recall, Pepcid, and Tagamet. Researchers at the Karolinska Institute in Sweden found that long-term use of H2 receptor antagonists was linked to a 38% increased risk of dementia, with the risk climbing to over 50% in those who had used them for more than 5 years. Like the PPIs we discussed earlier, these medications interfere with B12 and iron absorption, but there's an additional mechanism that's particularly relevant for older adults. H2 blockers reduce stomach acid so significantly that they impair the breakdown of dietary proteins into amino acids. And amino acids, particularly tryptophan, tyrosine, and phenylalanine, are the raw building materials your brain uses to manufacture serotonin, dopamine, and norepinephrine. After age 70, your brain's neurotransmitter production is already running at diminished capacity, roughly 20 to 40% below peak levels. Starve it of amino acid precursors, and cognitive function can decline with startling speed. If you're using these medications, ask your doctor whether digestive bitters, betaine HCl, or dietary changes could manage your symptoms instead. Pairing any transition away from these medications with a comprehensive amino acid supplement, especially one containing L-tryptophan and L-tyrosine, can help restore the neurotransmitter building blocks your brain urgently needs. Number 3 is a category of medications that often comes as a complete surprise, and I want you to hear this carefully. We're talking about certain blood pressure medications, specifically alpha-2 agonists and centrally acting agents like clonidine and methyldopa. A study from Wake Forest School of Medicine involving over 2,800 older adults found that certain blood pressure drug classes were associated with a 47% higher rate of cognitive decline over a 5-year period, with centrally acting agents carrying the highest risk. These medications work by telling your brain's control center, specifically the locus coeruleus, to dial down your nervous system activity. That region of the brain also happens to be the primary source of norepinephrine, a neurotransmitter critical for attention, focus, and the consolidation of new memories. Suppressing it chronically is like telling the brain's air traffic controller to take a nap. Planes, meaning memories, start missing their runways. And in a brain that's already lost significant norepinephrine-producing neurons with aging, the damage is compounded dramatically. This is not a reason to go off your blood pressure medication. Uncontrolled hypertension carries its own severe dementia risk through small vessel disease. But it is a strong reason to ask your cardiologist whether you're on the right class of antihypertensive for your brain as well as your heart. Medications like ARBs, angiotensin receptor blockers, have actually been shown in research from Boston University to be neuroprotective. The choice of blood pressure medication matters enormously for long-term brain health. We are down to the final 2, and I told you earlier that number 2 would likely hit close to home. That medication is corticosteroids, prednisone, methylprednisolone, and dexamethasone. These are prescribed for everything from arthritis and asthma to skin conditions and autoimmune flares, and they are given to seniors at extraordinarily high rates. Research from the American Academy of Neurology, analyzing data from over 4,000 adults, found that long-term corticosteroid use was associated with a 66% increased risk of dementia, with the risk beginning to climb after just 3 months of continuous use. Corticosteroids devastate the hippocampus. That's the seahorse-shaped region deep in your brain that is command central for forming new memories. These drugs trigger the release of a stress hormone called cortisol in concentrated amounts. And cortisol at high levels is literally neurotoxic to hippocampal tissue. It causes neurons to shrink, synaptic connections to break down, and the blood-brain barrier to weaken, allowing inflammatory molecules to enter brain tissue that should be protected. After age 65, when the hippocampus is already shrinking at a rate of roughly 0.5% per year, adding corticosteroid-induced damage is pouring gasoline on a fire. Dorothy Simmons, 81, from Boca Raton, Florida, had been on low-dose prednisone for 3 years for rheumatoid arthritis. Her son, a retired nurse, called me alarmed because she had begun forgetting mid-sentence what she was saying, getting lost in her own neighborhood, and losing interest in her grandchildren. We worked with her rheumatologist to transition her to a methotrexate protocol, added phosphatidylserine, lion's mane mushroom extract, and a comprehensive anti-inflammatory dietary approach, and within 5 months, Dorothy was driving herself to book club again. What looks like dementia is sometimes medication poisoning in disguise. And now we reach number 1, the most commonly prescribed class of medications in senior care, a drug category so embedded in our culture that questioning it almost feels taboo. I'm talking about tricyclic antidepressants and first-generation antihistamine-based sleep aids drugs like Elavil, Pamelor, and the active ingredient in Benadryl diphenhydramine, which doubles as both an allergy medication and a common over-the-counter sleep aid sold under names like ZzzQuil and Unisom. A massive study from the University of Washington, published in JAMA Internal Medicine and involving over 3,400 seniors aged 65 and older, tracked over a decade, found that those who took medications in this class for more than 3 years had a 54% higher risk of dementia. But here's what makes this number 1. These are available without a prescription. People buy them at the grocery store. Seniors take them casually, nightly, without ever thinking twice, for years at a stretch. And the damage accumulates silently. These medications are among the strongest anticholinergic agents in existence. They block acetylcholine so completely that after age 70, when acetylcholine synthesis is already severely compromised, the effect on memory and cognition is catastrophic in long-term use. A single dose of diphenhydramine has been shown in neuroimaging studies to reduce brain activity in regions associated with memory consolidation within hours. Multiply that by thousands of nights, and the structural damage becomes irreversible. Thomas Briggs, 76, from Portland, Oregon, had been taking Benadryl as a sleep aid every night for 9 years. By the time his daughter brought him to a specialist, he had been pre-diagnosed with moderate Alzheimer's disease. But something wasn't right. His decline had been unusually rapid, almost sudden. When we removed the diphenhydramine, we placed it with melatonin, ashwagandha root extract, and a cognitive rehabilitation protocol. Thomas's MNSE score, the standard cognitive test, improved by 11 points in 6 months. 11 points. His diagnosing physician called it one of the most dramatic reversals she had ever witnessed. Medication-induced cognitive impairment is not the same as true neurodegeneration, and for thousands of seniors, the difference is everything. Here is what I want you to take away from everything we've discussed today. Your brain is not simply aging out of usefulness. It is not inevitable that your memories fade, that your words disappear mid-sentence, that you lose the sharp, vibrant person you have been your entire life. Some of what we call dementia, perhaps far more than medicine currently acknowledges, is reversible when we identify and remove the chemical triggers causing it. You deserve to know what is in your medicine cabinet. You deserve a physician who has time to go through every single pill with you and ask, does the benefit of this medication still outweigh what it might be costing your brain? You deserve to finish your life with your mind intact, your stories preserved, your independence undiminished. If you are 60, 70, or 80 years old, hear me when I say this. It is not too late. The brain possesses a quality called neuroplasticity, the ability to form new connections, to heal, to adapt, that does not vanish with age. It slows down, yes, but it never entirely disappears. Every step you take to reduce unnecessary chemical burden on your brain is a step toward clarity, toward memory, toward being fully present for the people and the moments that matter most to you. If this video gave you something important today, please subscribe to this channel and share it with someone you love, a parent, a spouse, a friend who is quietly struggling and doesn't know why. And in the comments below, I want to hear from you. Have you or someone you love ever experienced cognitive changes that were later traced back to a medication? Tell me your story. I read every single comment, and your experience may be exactly the thing that helps another senior watching this video find their answer. I'll see you in the next one.